Hey guys, welcome back. This is Miss Forkren here with another video, and today we are following up on the video I gave you guys earlier this week on bacteria and viruses, and talking specifically today about STIs, or sexually transmitted infections. Now let's do a quick review. Last class we talked about the difference between bacteria and viruses. And we know that bacteria are alive while viruses are not considered alive because they're not made of cells. Bacteria are unicellular. Some can be helpful. They're useful in the production of cheese, yogurt, buttermilk, but there are many harmful bacteria that can cause things like food poisoning, strep throat, pneumonia, syphilis, gonorrhea. And then when we think about viruses, we know they are not made of cells. They require a host cell to replicate. And some examples of that are the virus currently affecting us today, COVID-19, the flu, HIV, herpes, polio, and smallpox. And the main difference we talked about last class is that bacterial infections are treated and cured with antibiotics, while viral infections can be prevented with vaccines. But if no vaccine is available, you can only treat the symptoms of viral infections, which can cause them to have to either go away on their own, like the flu, or you may have these viruses for life because there is no vaccine or treatment option available. So how does this apply to STIs? Now, an STI, a sexually transmitted infection, is defined as an infectious disease that spreads from person to person during unprotected sexual contact. Now, some of these are bacteria and some of these are viruses. And if we think about that in terms of what we learned last class, the way we treat them, the way that they're going to affect you, and the possibility of you having these STIs for life changes based on whether they're going to be a bacteria or a virus. So today we're going to focus on these sexually transmitted infections. I'm just going to keep calling them STIs. And by the end of the lesson, you are going to be able to identify the most common STIs that can affect you, classify STIs between whether they're bacterial or viral infections, explore the treatment options, and identify preventative measures that effectively keep you safe from ever contracting these STIs, because some of them do not have successful treatment options that once you acquire this STI, you will have it for life. The common ones that we are going to be talking about and exploring today are chlamydia, gonorrhea, syphilis, herpes, HPV, HIV, and we'll touch on hepatitis B a little bit. And for all of those infections, we're going to explore, are they bacteria or virus, how you get them, the symptoms and sometimes long-term effects, and how they are treated. So let's get right into it. We will dive right into talking about chlamydia. All right. Chlamydia is a bacterial infection. Chlamydia is caused by a bacteria that affects both men and women and is transmitted most commonly through unprotected vaginal, oral, or anal sex. What that means is chlamydia can infect women's reproductive structures like the vagina and the cervix, men's reproductive structures like the penis, but even your mouth and your throat if you have oral sex with somebody that has chlamydia. Now, chlamydia, like many STIs that we are going to talk about today, usually have no symptoms, which can make it fairly dangerous. Symptoms that do occur are often burning, discharge of the penis or vagina, or pain during sex, usually in the female. But these can be mild or even not occur at all, causing people to not think that they have anything wrong with them. Now, if chlamydia is left untreated, it can cause a lot of long-term damage to reproductive organs. For females in particular, chlamydia can cause something called PID, pelvic inflammatory disease, that can eventually lead to infertility or stop them from being able to have children. Now, the good thing about this, chlamydia is a bacteria, right? And how do we treat bacteria? With antibiotics. Once you get tested for chlamydia, If you test positive, all the doctor is going to do is give you 2 pills, and you are going to take those 2 pills one time, and you are good to go. However, if you end up having sexual activities with somebody that has chlamydia again, you can get reinfected, but the treatment is very simple. All right, let's talk about gonorrhea next. Gonorrhea is another bacterial infection that affects men and women, transmitted in the same way as chlamydia through unprotected vaginal, oral, or anal sex. So once again, you can get it on your reproductive structures as well as in your throat. And most people, same as chlamydia, experience no symptoms, but if they have symptoms, they are similar to those of chlamydia: discharge, pain, abnormal bleeding. And what makes gonorrhea dangerous is that untreated, it can cause infertility in both men and women, and puts most people at an increased risk of contracting HIV. However, the treatment, once again, because it's a bacteria, is antibiotics. Instead of chlamydia, which is treated by 2 pills that you take once, gonorrhea is usually 1 single shot in the butt and you are good to go. But you can be reinfected. All right, now, syphilis, I believe, is the last bacterial infection that we are going to talk about, that once again affects men and women, is transmitted the same way through unprotected sex, but the symptoms are a bit different. Syphilis usually appears as one sore that may appear on the vagina, the penis, or the rectum, that appears several weeks after sexual contact with someone that has given you syphilis, and the sore will last a little while and usually go away. So, many people might think, oh, that's, just an ingrown hair, and not worry about it. But if syphilis is left untreated, it has very dangerous complications. Syphilis, many years, 20, 30 years down the line, while having no symptoms for that long, can eventually lead to damage in your brain, your nerves, your eyes, heart, blood vessels, liver, bones, and joints. Syphilis is one of those silent killers that, left untreated for a very long period of time, can cause a lot of damage to your body. However, as long as you get tested early and get regularly tested, if you find out you have syphilis, the treatment, super easy. 1 shot of penicillin and you are good to go. Now we're going to talk about some of our viral STIs. Herpes is probably one you've heard a lot about. Maybe you've heard that you can get herpes from a toilet seat. That is 100% not true. You cannot contract herpes from a toilet seat. Go to the Center for Disease Control website and they will confirm that for you. But it is a virus. And a virus that actually has 2 main types. If you've ever had a cold sore on your lip or around your mouth, cold sores are a symptom of herpes simplex virus 1, which usually affects the mouth area. And then herpes simplex virus 2 is what everyone commonly knows about, that affects the genital area. Now, once again, affects both men and women, transmitted through unprotected sex, and most commonly causes red blisters around the genital area that might last a few weeks, go away, but they often reoccur throughout a person's life with varying symptoms that sometimes include fever, feeling like you have a cold, because there is no cure for the herpes simplex virus. And there has not been a vaccine invented either to prevent you from getting it. Once you contract herpes, either herpes simplex 1 that causes cold sores around your mouth, or herpes simplex 2, you have herpes for life. So that is important when thinking about how to prevent yourself from getting this and choosing your sexual partners. You can only treat the symptoms as they occur later in life. All right, we'll talk about HPV. We are on to our last 2. HPV is also a virus. HPV is commonly known as genital warts. That is the main symptom that people contract with HPV. Like other STIs, HPV can be transmitted through skin-to-skin contact, as other STIs can be effectively prevented by proper use of a condom. A condom does not prevent all of the opportunities for skin-to-skin contact that someone can have during a sexual interaction that could lead them to contracting HPV. Now, HPV is actually the most common STI, and this might scare you a little bit, but around 80% of people, 8 out of every 10 people who have had any sort of sexual contact have contracted some form of HPV in their lifetime. Now, where that sounds super scary, most strains of HPV are fairly harmless. Most give you symptoms like a little head cold, you sniffle for a couple days, maybe you get a blister on your penis, your vagina, it goes away in a couple days, and that's as worse as it gets, and the HPV goes away. However, there are several strains that are incredibly harmful and can lead to cervical cancer in women. And fortunately, because HPV is a virus, there is a vaccine that has been invented and is available to protect people against the most dangerous strains of HPV that can lead to cervical cancer. And this vaccine is typically one that young adults get around the age of 13 before they start having any sort of physical contact with other people, so that they can protect themselves and the people around them or their sexual partners from developing the more harmful strains of HPV that can lead to cancer. All right, finally, we will talk about HIV. HIV is a virus, and it's a virus that specifically attacks the cells that help your immune system. So a lot of people that pass away from contracting HIV do not die of HIV. They pass away from other illnesses that affect their body that they could no longer fight off because of their weakened immune system. All right. And unfortunately, there is no cure or vaccine for HIV in this moment. People who contract HIV have it for life, which is dangerous because HIV can develop into AIDS. Now, AIDS is not the same as HIV. People are diagnosed with AIDS once they have contracted HIV that has progressed to a point where their immune system is considerably weak. It is super, super weak. But HIV does not always lead to AIDS. There is medication on the market now that when diagnosed early, when people get diagnosed early with HIV, they can start taking medication right away that can help stop the spread from progressing to full-blown AIDS. Because AIDS is incredibly dangerous. Once HIV progresses to AIDS and a person is diagnosed with AIDS, they typically, unfortunately, do not live past 3 more years from their diagnosis. So understanding HIV and treating it or helping the symptoms early can really, really help people's life expectancy once they have this virus. HIV is no longer a death sentence in this country because of that, because there are medications that once detected early can stop HIV from progressing to AIDS. HIV is completely non-discriminatory. It affects men and women and is an STI mostly because it can be transmitted by unprotected sex, but there are other ways people can contract HIV. Often, people who use intravenous drugs and are sharing needles with other people can contract HIV that way because they have now contaminated their own blood with the blood of somebody that has HIV, and it is spread that way. Women with HIV can also spread their HIV through their breast milk to their babies. So it's really important to diagnose and start treating people early so that they are aware of if they have this or not, especially if they are going to have children. Finally, I'll say that there are ways that you for sure cannot contract HIV. And you may have heard before that you can get HIV from just kissing somebody. Now, that is simply not true. It would actually take for you to contract HIV from kissing somebody from their spit, you would need to swallow 50 gallons of that person's spit in order to contract HIV from them they're having sex with. Now, who is at risk? Why are we talking about this? Because young people under the age of 25 are most susceptible to contracting any sort of STI. What makes people more likely is if you have multiple partners, if you are having unprotected sex, that's a surefire way to make you more likely to contract these STIs because you are not protecting yourself. Having new partners, for those whose sexual history you do not know, just because you know that you are clean and you decide to have sex with somebody that has had sex with many other people, if they do not know their own sexual history with all of those partners, they are putting you at risk. Any history of STIs in you or your partner can put you more at risk. Intravenous drug use can put you at risk for contracting HIV. And obviously having sex with someone who knowingly has an STI can make you more vulnerable because they can directly infect you if you are not safe. However, there are preventative measures that you can take. Sex can be safe. For things like hepatitis B, which is an STI we didn't really talk about, and HPV, there are vaccines available that can protect you right away from contracting these viruses that you could potentially have for life and can hurt you. Talking to your partner is really, really important. Understanding their history as well as your own can protect you both from and help you make good choices as to how you are going to proceed sexually. Now, condoms. Condoms are not just to avoid pregnancy. I know a lot of the time on people's minds when having sex with somebody, you're worried about, man, you know, I don't want this to lead to pregnancy. I don't want to get pregnant. So maybe the girl in the relationship decides to go on birth control and the girl says, okay, I am on birth control now. I don't need any of my partners to wear condoms. That is just simply not true because condoms are not just to avoid pregnancy. If used correctly, condoms are effectively protecting you from many, many, many STIs that are transmitted through semen and unprotected sexual contact. Get tested, preferably with every new partner. Because just like I said, if you don't know the history of that partner who could have had unprotected sexual contact with several people before you, and they may have no symptoms, because many STIs have absolutely no symptoms at all, you do not know how that person could potentially be hurting and infecting you until you get tested to see if you have contracted any STI, because so many of them have absolutely no symptoms. And now we know down the line they could cause things like infertility. You could have certain viruses for life. They can cause damage to your reproductive structures. They can cause damage to your brain. Without getting tested, without knowing, that's how many of these are spread and hurt more and more people. One final easy way to make good choices when having sexual contact for a partner and preventing against sexually transmitted infections is looking at your partner. Inspecting your partner. Before deciding to have sexual contact, take a look. Does your partner have any unusual bumps, blisters, discharge around the penis or vagina area? Do they have any cold sores around their mouth? Looking and just being aware can help you decide whether you want to go forward with that sexual contact or not and potentially put yourself at risk. So to circle back, we're just about done. Many of our STIs are bacterial, as we learned, such as chlamydia, gonorrhea, and syphilis, and they can be treated with very simple antibiotics. You just have to know that you have them and get tested in order to be treated. However, many are viral, like HIV or HPV, which means that if there is no vaccine, you have that STI for the rest of your life. And having unsafe sex practices can lead to dangerous consequences, such as contracting HIV and not getting medication early enough to be treated so that it doesn't turn into AIDS, or contracting herpes that you end up having for the rest of your life and can unknowingly pass to other sexual partners. So we've come to the end. We've identified some common STIs. We know the difference between which ones are bacterial and which ones are viral. We know our treatment options, if there are any treatment options available, and I gave you guys some preventative measures that effectively keep you safe from contracting these STIs. So I'm going to close out here. We are ending off this video for you guys. Please, please, please wrap it up, be safe, wear condoms, talk to your partner, because many of these STIs are no joke, and I want all of you to be safe, make good choices, and protect each other. So I will see you guys later. Have a good rest of the week. Bye.